If you've recently had a tooth extracted, especially a wisdom tooth, you're probably eager for everything to heal smoothly. But what if something feels off? Maybe you're experiencing more pain than expected, and you're wondering if it's just part of the process or something more serious. Let's talk about one of the most common post-extraction complications: dry socket. What is dry socket? Imagine this. After a tooth is pulled, your body immediately starts the healing process by forming a blood clot in the empty socket. This blood clot is like a protective shield that covers the underlying bone and nerve endings, preventing anything from getting in and causing trouble. But in some cases, this shield doesn't stick around. Either it never forms, it gets dislodged, or it dissolves too early. When that happens, you're left with what's called a dry socket. Without the blood clot, the bone and nerves are exposed to air, food, and fluids, and this can cause some pretty intense pain. Think of it like having an open wound that keeps getting poked and prodded. It's not going to feel good, and it's not going to heal as quickly as it should. How common is dry socket? You might be wondering, is this something I really need to worry about? Dry socket isn't a guaranteed outcome, but it's not uncommon either. On average, about 2% to 5% of routine tooth extractions result in dry socket. However, if you've had a lower wisdom tooth removed, those odds go up, sometimes as high as 20% to 30%. Certain factors can increase your risk, such as smoking, poor oral hygiene, and even the complexity of the extraction itself. Women who take oral contraceptives might also be more prone to dry socket due to hormonal influences on blood clotting. So if you fall into any of these categories, it's worth being extra cautious. What does a dry socket look and feel like? So, how do you know if you have a dry socket? Let's start with what you'll see. Normally, after a tooth is extracted, the socket should have a dark red blood clot. But with dry socket, you might notice that the socket looks empty, and you might even see the bone at the bottom, which can appear white or yellowish. The surrounding area could be swollen and inflamed. Now, let's talk about the pain. And trust me, you'll know it when you feel it. Unlike the usual discomfort that comes with any tooth extraction, the pain from a dry socket is on another level. It typically kicks in a few days after the extraction, and instead of getting better, it gets worse. The pain can be intense and might radiate to your ear, eye, temple, or neck on the same side as the extraction. You might also notice a bad taste in your mouth or experience persistent bad breath. If over-the-counter pain meds aren't cutting it, there's a good chance you're dealing with dry socket. Let's dig a little deeper into what causes dry socket. While the exact reason isn't entirely understood, several factors can contribute. Trauma during extraction. Sometimes the extraction itself, especially if it's tricky or involves a lot of force, can disturb the blood clot. Infection. If you had an infection in the area before the extraction, it could interfere with clot formation. Smoking and tobacco use. Nicotine reduces blood flow, which can impair healing. Plus, the action of smoking can physically dislodge the clot. Oral contraceptives. Hormonal changes due to birth control pills can affect how your blood clots, increasing the risk of dry socket. Poor oral hygiene. If you don't keep the area clean, bacteria can break down the clot. Excessive mouth rinsing or spitting. If you're swishing too vigorously or spitting forcefully, you might accidentally dislodge the clot. Treatment and management of dry socket. If you think you have a dry socket, the best thing you can do is get in touch with your dentist right away. Here's what they might do to help. Medicated dressings. Your dentist can apply a medicated dressing or packing to the socket. This not only helps ease the pain, but also provides a barrier to protect the exposed bone and nerves. The dressing might need to be changed regularly, so expect a few follow-up visits. Pain medication. Depending on how severe your pain is, your dentist might prescribe stronger painkillers to help you manage it. Flushing the socket. Sometimes food particles or other debris can get stuck in the socket, making things worse. Your dentist might flush out the socket with a saline solution to clean it out. Antibiotics. If there's any sign of infection, antibiotics may be necessary to prevent it from spreading. Follow-up care. Healing from a dry socket can take a bit longer, so staying on top of your follow-up visits is important. Your dentist will monitor the healing process and make sure everything's on track. How to prevent dry socket after tooth extraction. The good news is, there are several steps you can take to reduce your chances of developing a dry socket. Avoid smoking. If you smoke, try to stop for at least 48 to 72 hours after your extraction. Better yet, quit for a week or more to give yourself the best chance of healing. If quitting is tough, talk to your dentist about strategies that can help. Follow your dentist's instructions. Your dentist will give you specific aftercare instructions. Follow them to the letter. This might include taking prescribed medications, avoiding certain activities, and being careful with your diet. Maintain good oral hygiene. Keep the extraction site clean but be gentle. Avoid brushing directly over the area for the first 24 hours. After that, you can start rinsing gently with warm salt water, but avoid anything too vigorous. Watch what you eat. Stick to soft foods for the first few days. Think yogurt, applesauce, mashed potatoes, and smoothies. Avoid anything that's too hot, spicy, crunchy, or sticky. Attend follow-up appointments. Your dentist may want to see you for a follow-up to make sure everything is healing as it should. Don't skip these appointments. They're important for catching any issues early. Will dry socket heal on its own? Here's the deal. Yes, dry socket will eventually heal on its own, but it's going to be a rough ride if you don't get it treated. The healing process can be slow and painful without intervention, taking several weeks for the exposed bone to heal completely. But with the right care, like medicated dressings and proper pain management, you can expect the pain to start easing up within a few days, and the socket should start filling in with new tissue soon after. So, while dry socket is certainly a setback, it's not something you have to suffer through without help. The sooner you get treatment, the faster you'll be back on the road to recovery. While dry socket is one of the more unpleasant complications that can arise after a tooth extraction, it's manageable with the right care. By understanding what causes it, how to recognize it, and what to do if it happens, you can take proactive steps to ensure a smoother, less painful recovery. And remember, if something doesn't feel right after your extraction, don't hesitate to reach out to your dentist. For more dental tips, log on to smile-wide.co.in.